Assalamu alaikum warahmatullahi wabarakatuh. Bismillahir Rahmanir Rahim. So today's video is on celiac disease. So this is an illness caused by an immune reaction to eating gluten. So gluten is a protein found in foods containing wheat, barley or rye. So if you have celiac disease, eating gluten can trigger an immune response to the gluten protein in your small intestine. So as this happens over time, the reaction damages your small intestine's lining and prevents it from absorbing nutrients in a condition known as malabsorption. So if you have this intestinal damage, this can cause symptoms such as diarrhea, fatigue, weight loss, bloating, and anemia. Currently, there's no definitive cure for celiac disease. Symptoms of celiac disease can vary for each individual, so they can be different in children and adults. But generally, the symptoms are diarrhea, fatigue, weight loss, bloating, gas, abdominal pain, nausea, vomiting, constipation. And also, there is other stuff that's not related, but you get anemia as well from iron deficiency due to decreased iron absorption, osteoporosis due to loss of bone density, or osteomalacia, which is known as softening of the bones. You can also get dermatitis, mouth ulcers, headaches, fatigue, and nervous system issues such as numbness and tingling in the feet and hands, as well as joint pain. Your genes combined with eating foods with gluten and other factors can help contribute to celiac disease, though currently there is no known cause. So other causes perhaps could be infant feeding practices, gastrointestinal infections, and gut bacteria, but these haven't been proven as of yet. So celiac disease can become active after surgery, pregnancy, childbirth, viral infection, or severe emotional distress. So what happens is when the body's immune system overreacts to gluten in the food, this reaction damages a tiny hair-like projection called villi, which line the small intestine. The villi, their purpose is to absorb vitamins, minerals, and other nutrients from the food that you eat. So if your villi are damaged, you can't get enough nutrients no matter how much you eat. Complications include malnutrition, as your small intestine can't absorb enough nutrients. This can lead to anemia and weight loss. And for children, can lead to growth and short stature. Bone weakening can lead to osteomalacia. So if you can't absorb vitamin D or calcium. Infertility and miscarriage. So same again, malabsorption of calcium, vitamin D can contribute to reproductive issues. Lactose intolerance. So if you damage your small intestine, this is called abdominal pain and diarrhea after eating or drinking dairy products which contain lactose. So once your intestine is healed, you might be able to tolerate dairy products again. Cancer as well. There's a greater risk of forming cancer, including intestinal lymphoma and small bowel cancer. And you can also get seizures and disease of the nerves of hands and feet called peripheral neuropathy. People don't know they have celiac disease, but blood tests can help diagnose it. This includes serology testing, looking for antibodies in your blood. So elevated levels of certain antibody proteins can indicate an immune response to gluten. Genetic testing for human leukocyte antigens can be used to rule out celiac disease. So these include HLA, DQ2, and DQ8. And endoscopy as well can help diagnose, as well as a capsule endoscopy. So this involves using tiny wireless cameras to take pictures of the entire small intestine. The best way to manage this disease is to have a lifelong gluten-free diet, and that includes barley, bulgur, farina, graham flour, malt, rye, semolina, spelt. So if you even taste amounts of gluten in your diet can be damaging even if you don't have symptoms. So it can be hidden in food such as modified food starch, preservatives, food stabilizers, prescription over-counter medications, communion wafers, Play-Doh, certain makeup products. Now, for the treatment for deficiencies, you can have copper, folic acid, iron, vitamin B12, vitamin D, vitamin K, and zinc. So that's the end of today's video. So thanks very much for watching, and I hope to see you in the next one.